Hello, and welcome to the fourth episode of the Ask Your Aviator series. My name is Lawrence Amukono. I'm the Chief National Continuous Monitoring Coordinator at Kenya Civil Aviation Authority. And today we'll be discussing passenger operations amidst the COVID-19 pandemic. And to help us discuss this topic, I'm joined by our colleagues from the aviation industry who will introduce themselves. I'll start with the gentleman.
Hello viewers, my name is Captain Njoroge, Director of Operations at Kenya Airways. From a KCAA perspective, I'm Head of Operations for the airline.
My name is Kano Waidaka. I'm the Executive Secretary of the Kenya Association of Air Operators. The Kenya Association of Air Operators is a national body that represents about 90% of the licensed air operators.
Thank you, Lawrence. Good morning, viewers. I'm Simon Peter Njoroge. I'm the Airport Operations Manager at the Jomo Kenyatta International Airport.
Thank you very much, gentlemen. So to allow us to understand the perspective of passenger operations amid COVID-19 pandemic, I will start with Captain Njoroge from Kenya Airways. I know most of our viewers and most of the public at large are intrigued by why we use KQ for Kenya Airways and not KA. Maybe you could just tell us a bit of that.
Interesting, Lawrence. This was before I was born, actually. The caption KQ, where it came from. So airlines come up with IATA codes, and IATA is in charge of all the airlines, is association in charge of all the airlines around the world. And the KQ, or Kenya Airways, would have used the term Kenya Airways, short KA. However, there was an airline that was formed before us, and that was Cathay Dragon in Hong Kong. And Cathay Dragon picked up the code KA. In that case, when we started up, we could not take up the code KA, so ours was KQ, and in aviation terms, we normally use KQA for all our flights.
Thank you. I think that's a very interesting insight that the codes are located elsewhere, and therefore you had to share the codes depending on what's available. So to my friend Simon Peter, tell us a bit about Kenya Airports Authority operations.
Oh, first of all, Lawrence, thank you for the question. And maybe for the benefit of the viewers, I'll just briefly speak to the fact that Kenya Airports Authority is established by law in Kenya back in 1991. And our mandate, briefly, is to provide facilitative infrastructure for aviation services from Kenya and beyond.
Thank you very much. Colonel Waidaka, you represent the interest of a majority of the certified air operators. And together with Captain Njoroge, probably you'll give us an insight on how the aviation industry has managed to recover during the restart of the aviation operations. Specifically to Colonel Waidaka, we are looking at small aeroplanes. A majority of the people have interacted with the big aeroplanes operated by Kenya Airways. We've discussed issues of hyperfilters on flights. How are the small aeroplanes coping with operations at the same time protecting the public during this pandemic?
Yeah, thank you, Lawrence, for that. Perhaps first I should start by emphasizing the need of or the role, objectives of the Kenya Association of Air Operators, and say that it is to foster and promote as well as protect the interest of all air operators and associated businesses. And as you know, the aviation industry worldwide is very, very highly regulated. For the good of it, there's a good reason for that high regulation. And I can point out here that even the small aircrafts, as you call them, and the large aircraft, they are strictly controlled and oversighted by the CAAs to ensure that they maintain the international civil aviation organization standards. Having said that, now that the issue of the COVID-19 has hit us, And as you know, it's not only us, but it is the whole world, making the aviation industry the worst hit because people are very, very scared of the flying. It is important perhaps to point out that we are satisfied with the protocols that have been developed to protect the flying public, both for the small aircraft and the larger aircraft, and there is no difference in the protocols. They are applicable to both small and large aircrafts, that they must be maintained. And really all that there is to it is enhanced hygiene, which is already a standard that your aircraft has got to be, in good state of operations. But generally, the membership, our membership has been actually put to task to ensure that their SOPs now covers the enhanced hygiene observations to protect our passengers.
Thank you. Captain, any addition on that?
So I'd like to echo what Colonel Waithaka said in terms of aviation being a very regulated industry. The cleaning protocols or the COVID protocols that have been now promulgated are only but an addition to what we normally do. So Kenya Airways, in conjunction with KCAA, Kenya Air Operators, and Ministry of Health, Ministry of Transport, did sit down and come up with protocols, and we have implemented them to the letter. Now, what that does is that, from a passenger perspective, when the passenger comes to the airport, they enter an aviation corridor, a public corridor that is safe. From the time they get into the airport, and I'll let Simon talk about a bit of that. They get their temperature checked, and some of the things that they've done in the airport, they've been quite instrumental in making sure that we are safe. Every operator is safe while they operate within the airports. They get their temperature checked, they get into the aircraft, and from an operator's perspective, passengers board from how they are seated. So the passenger who's seated at the very last row boards last. That way they do not interact with the person who's seated at the front of the aircraft. That is part of the social distancing. Then all the passengers will require to wear a surgical mask. So masks that are knitted at home are not allowed in the aircraft. It's the surgical mask assures us that the droplets, if you breathe out heavily, the droplets do not go to the or are not spread within the aircraft. Now, in addition to that, the aircrafts with air conditioning. So not all aircrafts have air conditioning. However, Kenya Airways aircrafts all have air conditioning. Have HEPA filters, and the air conditioning flows from top to down, and it's pressurized. So even if you breathe out, because the air is pressurized downwards, your droplets will move downwards towards your legs or towards the floor. And then it will be filtered out. So next to every seat, there's a filter there's a air vent that filters out the air, and then it goes to the air conditioning and it's filtered. And the HEPA filters, which are high efficient particulate air filters, are actually remove 99% of the pathogens that are in the air. So within the aircraft, it's quite safe. Colonel Waithaka talked about food. For all flights that are less than an hour and a half, we do not serve food. So unfortunately, when you're going to Kisumu Dala, you will not have that drink or the peanuts or the sandwich that you used to enjoy. Just for now, while we are trying to stop the spread of COVID, but for longer flights, we do have full service and it's pre-packed.
Yes, just before we go to Simon, I'd like to have a discussion around the aircraft. You know, you've brought in the issues of the HEPA filter, and it's unfortunate you've removed meals on some of the flights. You know, the whole concept about flying is the pampering and the good treatment we receive. There is, around the aircraft itself, we have had conversations, or people have been concerned that the time the international or the operations were grounded around March, most of the aircraft have remained on ground for a while. Now, even your vehicle, if you leave it on ground for a while without driving it, there are processes you have to go through. You don't just fire it up and drive off. What are the guarantees, or what kind of maintenance activity do air operators, and specifically Kenya Airways, do to ensure that, or to satisfy the public that the aircraft, although having been parked for slightly over 3 months, are in good airworthiness condition?
Thank you for that question. Interestingly enough, you compared a vehicle and an aircraft. They are far apart from. So I can park my vehicle for about 3 weeks, and all I need to do is maybe cover it and wash it, and just leave it there. From a vehicle, from an aircraft, when you park an aircraft, the engineers have been busy throughout this period. In fact, they have not taken any time off. The engineers have got to ensure that the parts of the aircraft, the electrical parts, are stored in a way that they cannot short circuit. So they disconnect the electrical components. The engines are covered. All the inlets are covered. Then they make sure that every so often they start up the engines of that aircraft. And we have videos of that Kenya Airways has done, of what our maintenance personnel, who we are proud of, have done. All these aspects of maintenance are documented, and the maintenance staff go through a checklist, a rigorous checklist, to park an aircraft and to unpark an aircraft. It's interesting that it takes a whole 24 hours to 48 hours to unpark a 787. It takes us about a whole day to unpack an Embraer, not like starting your car. So there is quite a number of tasks that our maintenance team have done. So there is confidence that when you fly, the aircraft is in tip-top shape.
Thank you. It's actually an interesting environment. It means when the airlines grounded operations and there were no passenger operations for a significant duration, most of the time the airlines still maintained the aeroplanes.
Correct.
Okay, thank you very much. Now to Simon, our colleagues have discussed the kind of environment we expect when we get into the aircraft. Just as you touch on that with regard to the Kenya Airports Authority, there is this challenge that very many people are grappling with. The issue of having face masks on vis-a-vis security at the airport. You know, it is very difficult today even to recognize your friends in a mask. How does that tie down when you are doing your airport security and people coming in with masks?
Okay. First of all, Lawrence, I just want to reiterate some of the comments my two colleagues have made so far. Right now, we're very much in an era of what you would consider biosecurity. And what that means is the safety and security of travelers still remains a high priority in civil aviation. And everything we're doing at the airport is part of a complementing measures to support the existence and the growth of air transport. So let's start from the very beginning. Yes, face masks are mandatory, both in the coming to the airport and on board the aircraft. And that should be clear to all our viewers and all our listeners today. So if I could just quickly walk you through the process. Even by the time you are leaving your house, you've already received information from the airline regarding what you need to have for the flight. Those requirements, I will repeat myself again, are complementary to those of the airport. And as a basic example, coming through Jomo Kenyatta International Airport, you will be required to have a face mask as you approach our primary screening yard. You will find thermal screening. You will wash your hands, and you will proceed to the terminal building. As and when it is required for your face to be recognized, you're allowed to pull down your mask for your image to be taken, especially at immigration, or for your identification purposes, should there be a need for it. So the face mask, as you know, is something that you can wear and remove Right now, we're in a room and you can see my face without a face mask.
Yep.
If you need me without a face mask, I'll remove it temporarily and then put it back on. So the security processes, in many ways, complement the biosecurity era that we are in now. So one, I would expect a traveler to have a mask on up until the time his identification is needed to be proven by a boarding agent, by an immigration member of staff, by a security member of staff. These things, for me, are, shall we say, we should assure the public that these are safe. And remember, these things are not happening in a vacuum. You have a 1.5 meter social distancing environment. And I would expect that when a customer approaches our security point, is already standing at a marker, which are well applied all over the airport. And they would show their face. This is about face, for example. Another important feature, Lawrence, that you probably need to know is, as we go down this road, we know that the current pandemic is largely spread through viruses that exist in the air, isn't it?
Yeah, through droplets.
Through
out
droplets.
of- yeah.
So remember, to assure the public that there is sufficient social distancing, should give them is enough comfort for everybody. Secondly, our objective is to mitigate the risk of the spread of the virus. And I think at the airport, we've made and put the necessary measures around security screening that allow for that mitigation. Maybe a secondary issue, now that passengers would likely want to know, is regarding their own personal belongings and how they are handled at a security screening point. Now, one of the things that's happening today is, again, airlines are spending a lot of time communicating to their passengers, asking them to park smart. When a passenger approaches the security screening point, they will be expected to put all their personal items in their bag. Yeah? With that, there is a less need for them to put shoes and clothes and watches in a separate bin. So they're being encouraged to put everything in their one bag. Second thing that they would observe is that our bins themselves are actually being sanitized after each and every use. Now, our airport and many other airports in the system are constantly investing in visible sanitization and cleaning measures. So everybody today is walking through an airport and seeing cleaners, sanitization of contact surfaces, of bins, and any other part. What we've also seen is that at security points is where the highest contact takes place. Again, lots of visibility with cleaning and sanitization. So I think in terms of providing that safe environment, we've made the right steps.
I don't know. When the passenger operation restarted, of course, the new protocols came in and everything. And from the airline operator perspective, just carrying on from what our colleague from Kenya Airports Authority has said, what has been your experience so far and any challenges? I see you've spoken of boarding the aircraft from one direction so that the first guys who board have no contact the last guys who board and everything. And I know this has an effect on how your passengers take it up and how they react to it. What has been your experience in terms of any challenges in handling passengers with established protocols?
The established protocols have actually been quite welcomed by the passengers. So the protocols are not the biggest challenge that we actually face. So everyone is looking after or looking to ensure that they remain healthy. Now they will social distance themselves. They will ensure that they sanitize themselves. They'll ensure they come with something to disinfect their hands whenever there's no bathroom next to them. So the passengers have taken up these measures well. Now, one of the biggest challenges that we have is the many rules by different governments and states that have been imposed. Now, my poor check-in staff has someone going to the US via France, and they have to check the rules in Paris, whether this passenger is allowed to transit through Paris, when their COVID certificate was taken, read a COVID certificate by either KEMSA or by Nairobi Hospital and be able to interpret it and know that it's a PCR test or is it an antibody test, and then check whether they are allowed into the US, check whether their visa is okay. So we have added on to the items that our check-in staff, our staff at the gates have to go through and check if a passenger is actually okay to travel. That has led us to a bit of delays. Our on-time performance is not bad. It's actually good. It's in the 80s and some of it in the 90s because the number of flights are reduced. However, we are having lots of challenges with that regulation. And passengers have to bear with us because I would rather delay a flight for an hour and make sure I carry 10 passengers to, and I'll use an example, to Kigali, which had required the PCR test to be within 72 hours. So if I leave these 10 passengers, their COVID test expires. I cannot connect them on my next flight, which is maybe the next day because they're
now bad.
Yes. So I delay the flight to make sure this person gets there because I don't want to leave the problem for the airport operator. And then so it becomes difficult. Can they enter Kenya? Maybe they can't enter Kenya. So it becomes quite a difficult and challenging environment to cope with all these new regulations, new rules. So we would maybe urge the hospitals and the clinics to come up with one format that is easy for us as airlines, and we're not doctors, to read.
It's already difficult to understand what a medical doctor writes in terms of diagnosis. Right. So you can imagine when airline personnel have to read medical documents and interpret them.
Yes.
I think this is an area that we can explore collaboration with the Ministry of Health to standardize some of the documentation to make it easy for the personnel in other industries to be able to appreciate what is happening. I don't know, Colonel Waithaka, looking at all these new issues coming up, apparently the rules are okay from the conversation we're having, from the airport operator perspective and from the airline operators. The rules are okay, they appreciate why the rules are there. What has been the uptake in terms of passenger numbers? Are we seeing passenger numbers growing? Are we seeing a steady increase in uptake of air travel since the restart? Because I know after the restart, the movement had to be a bit slow and then pick up.
Yeah, thank you, Lawrence. It's not very nice, as it were, as far as numbers are concerned. And I think that's the very reason you have actually called this kind of a discussion where we are saying, ask your aviator of how then, and it is going to give confidence to the passenger. I think that is the objective of this kind of meeting. I will say that ever since we started the domestic operations, we started before the international operations. It started at a very, very slow pace in July, but we have seen numbers start increasing. There are challenges, of course. One of them is the mythical mind that people are thinking that you don't want to travel too much because this virus or the unseen enemy is everywhere. Yeah. But it is important to put it that aviation industry is very, like I said before, very highly regulated. So safety and security for air passenger is a key. Just like we keep saying that aviation industry has got 4 pillars. And all those 4 pillars are safety, security, safety, security, safety, security, safety, security. We don't know anything else. Yeah. And the aviation industry, to see, is so used to changes of regulation. So far as we have got the information, no tracing has actually pointed out that somebody caught COVID-19 in an aircraft so far. And we are very happy about that. So we are still the safest and the healthiest. So we encourage every passenger who wants to take off to first of all think about air before they think about the road transport. I know that they are doing quite a lot about it, but we are still very safe and we are maintaining that that legacy of being the safest mode of transport.
Good, very interesting. You kind of took out a question that I was actually gearing to shoot at Captain here, in terms of if there have been any experience of or any record of cases detected and could be traced back to having been contaminated due to air travel. But even as you give us that information, between you and Simon Peter, you know, the protocols have kind of increased the layers in how you do your operations, both at the airport and in the aircraft. The boarding approach, the management of passengers, the airport terminal handling of passengers. As we anticipate the increase in numbers, are we seeing the capacity to hold or to handle the numbers we've been handling in the past, even with these protocols?
Right. So I'll answer that in twofold. First, before I answer that question, I'll want to echo what Colonel Wadhaka said. The aircraft is safer. Hospital air is refreshed every 5 minutes. Aircraft air is refreshed every 2 minutes. So it's cleaner than hospital air. So you're better off being in an aircraft, even if you're sick, than going to a hospital. On a light note. But
I hope we don't take that literally.
We're not carrying sick passengers. So most of our passengers are tested, and yes, we, as Colonel Wadhaka said, we have not had any contract tracing based on the passengers that we've carried so far. Now, in terms of the passenger numbers, we started operating on the 15th of July for domestic operations. And from 7, we used to operate 7 to 10 flights a day. We started operating with 2 frequencies a day. Our load factors were at about 50%. So we do not foresee the loads increasing too much within the year. So with the type of social distancing that we have in the airport, we expect that the airport infrastructure should be able to enable us to ferry the passenger within the space that we have right now. So we don't expect that the airport infrastructure is any less than what we require. So the departures will be spread out throughout the day. So passengers have to adapt to that. What used to have a connection within an hour will change. So you might have your connection now, connection time within 2 or 3 hours, but that is just to enable us to have less people within the airport, and it's for your own safety as a passenger. Even with the international departures, we have right now less departures than we had before. IATA forecast that it will take us between 3 to 4 years before we recover to the 2019 levels. So the airport infrastructure is such that, let's say, take KCAA, which can accommodate about 10 million passengers a year. It'll take us a while before we get to that level. This is not just because of passenger confidence, but also the economies that have been dented by COVID.
Yes.
So there is not enough money to go around for people to be able to travel. So we should be able to cope with the number of passengers coming into the airport. So feel confident and to come in, travel within the air industry, within the public health corridor that is very safe, and we shall make sure you get to your destination safely.
Simon.
So Lawrence, first of all, I just want to clarify one small misconception. Airports were not closed.
Yeah.
There was a restriction on air travel because of the COVID pandemic.
Yes.
Hence why the public health corridor existed, hence why repatriation flights continued, cargo flights continued, and I would like to clarify to everybody, the airport was still remained open. We actually were at work as essential service workers. Yeah. So, but I think you will find that among this esteemed group we have, we'll probably tell the story over and over again using different words. So, for example, just like my fellow colleagues have mentioned, let's talk about the numbers. We have seen over the last now going to about a month since the resumption of domestic travel, a gradual increase in the number of passengers going through the airport. It is gradual. Point is, it is there every day. And that we have to give credit to the flying public and people who are confident enough to get on board the aircraft, leave to destination A, Kisumu, Eldoret, Mombasa, and so on. So for sure, there is a level of demand that is still existing. And we hope that that continues in the future. The next thing that is important is international travel. And I must say here in this room that there has been a perception that, COVID came from international travel. It came by air, and it came from international travel. It's a perception.
Yeah.
And many of the articles I'm reading point to that direction. What's important to note is, for international travel, we've also seen a strong and growing demand in traffic, both those who are coming because they couldn't come before repatriation flights, and those who are leaving purposely to go to places, and those who are actually making the decision to come to Kenya as a result of the government's decision to open the economy for international travel. So we are actually seeing some tourists coming through to Kenya. And as you know, there is already a list of approved countries that are allowed to come to Kenya without the need for quarantine. What we are seeing today is the confidence is there, it is building. There are some, I would call, teething problems which I think can be dealt with over time. These are revolving around the COVID test itself that was talked about earlier, the COVID tracing and tracking forms and so on, which I would just like to encourage all users to go online and use the COVID link to actually register themselves before they come to Kenya. Now, coming back to the airport and airport capacity, because we've talked about that just in passing. The reality is, for those who come to the airport recently, you will find that the seat in between you and the next person has been blocked out. And that allows the 1.5 meter social distancing. In numbers, that has meant that we've lost about 30% of the seating capacity in our boarding areas. Now, a simple mathematics will show you that, yes, we're remaining with 70%. Airlines are flying only at 30% of pre-COVID numbers. And the pre-COVID numbers got nothing to do with the entire airport capacity as well. I hope I've not lost everyone in that conversation.
You were able to handle it even pre-COVID.
Even before COVID, we were able to handle the numbers. And that simply should tell you that, yes, there is enough and sufficient capacity at the airports to handle the existing traffic and for a duration of time to come. Remember, one thing that we're probably not talking about in this group, and also for the public to remember, is all these measures we have in place today are temporary measures. ICAO and IATA have been very clear that the whole COVID testing, social distancing, face masks and so on, these are temporary measures that over time will likely fade away and will go back to some semblance of a normal that will allow us, one, to have more passengers traveling, for us to use our airports more, and also to create employment in adjoining industries. So just again, confidence is the key word. We are very confident we can handle the traffic. We're very confident that the numbers will continue to grow over time. And I think the flying public should be absolutely certain that they are safe in the airport as much as they are on board an aircraft.
Just to carry on with that discussion, as much as we have talked about protection of the flying public and the passengers, the biggest challenge, I think, what very many people would be concerned with also, is how are we protecting our personnel? Because we have airport workers who interact with the traveling public. We have airline workers who interact with the traveling public. And what has been the preparedness? Because as an employer, you want to take care of your people also. What has been the preparedness both for the airport and the airlines in terms of protection of their personnel?
Yeah. If you don't mind, I'll go very quickly through that. And can I just say that's one of the best questions from this morning? Thank you. So first of all, it's a multi-layered approach. Yeah, and no one mitigation measure reduces our risk. All of them together make a holistic outcome. So I'm going to talk very quickly about first the software, and then I'm going to talk about the hardware. Okay, the software is relating to awareness. It's relating to the reinforcement of the message of social distancing, awareness of COVID, its signs and symptoms, and all other activities that personnel need to take
into cognizance as they deliver their services. So the Airport Authority, in conjunction with partners from other governments and the government of Kenya, has actually rolled out a COVID awareness training package that is done online. And as at now, the numbers just from today is about 5,000 users who've actually gone in to make themselves aware of COVID itself and what measures they can take to prevent it in their day-to-day activities. Now, that for me is a big component of the software. Another part of the software is, again, how we relate to each other and how we engage, especially our shift workers, people who are in the line of fire, as it were, in terms of delivery of service in the airport. So the daily briefings are taking place, although not in the previous format that you knew where you had a large group of people. No, this is now taking place in a smaller format, supervisors, not more than 4, getting together, walking to a point of service and actually talking to a group of people at their place of work with social distancing in place. So to me, the software is about prevention, changing the mindset, and the change of culture. That's the software part. And we're doing that consistently at the airport, including all other airports in the system. Now, the public always likes to see the hardware. And that's the interesting part of this conversation. The hardware is about, let's talk about security screening points, for example. All our security screeners are equipped with personal protective equipment, namely surgical face masks, gloves, and are also provided with hand sanitization. That's very, very important. That's the hardware. Another component also is the fact that there are places where it's inevitable that there will be a large group of people working together. I'll give you a real example. You go to our secondary screening, T1A level 1. You'll actually find very many people working together. What have we done? We've actually split it up so that you get screened at one point, there's a space, another point. So there is a bit of space and social distancing created that doesn't allow us to have so many people interacting with each other. Another very interesting thing that I think the travel public should also remember is you've got walk-through metal detectors, you've got full body scanners that do not actually require you to get touched.
Yes.
So again, reducing the physical contact. Another component of hardware is that one. And maybe finally is, I would call, the way of work. We've restructured our shift system such that now no 2 shifts are coming into contact with each other. What does this mean? First of all, our buses for staff, we provide transport to our staff. Our buses for staff actually have social distancing on board. Second thing, when the shift comes in, one shift is leaving, the other one has to wait for the area to be sanitized before the others come on board. So in reality, again, this is about instilling confidence, but the public may not know about all these things we are doing.
What goes on in the background.
They may not know what goes on at the back of the house, but these are some of the few examples I can cite now. And there's others. For example, taking of temperature for staff before they come to work and when they leave work. The public will not see that, but it's actually happening on a day-to-day basis. The sanitization of buses at the ramp, that's happening. They don't see that. The sanitization of offices, the social distancing in offices. And also, a very interesting thing we've done, we've actually set up contingency plans for our offices. I think those who've been reading the news will probably tell you that instances where you hear a certain bank branch has been shut down because a member of the staff has been found with COVID. These are real things that are happening today. Within the airport system, what we've spent a lot of time doing, and give credit to all our, the passionate group of people we work with, have actually set up contingency plans that will allow us to continue providing services even in the unfortunate case of a case being found among our staff members. So in reality, again, a lot of back of house issues happening, but I would say today the contingency plans are in place, the temperature testing is in place, social distancing is in place, hand washing is in place, and yeah, the software is also in place. So thank you very much.
Thank you. Captain, what are you doing at Kenya Airways to protect your people?
I think after the answer that Simon has given, I will add on to only what he has said. Part of the things that we are looking at and we've implemented is clustering. So clustering of shift workers. When you come into the airport, the shift that comes in the morning will be the same shift that comes in the morning the next day and the next day. So they're clustered. So when you're working together, you're working as a team together. You take care of each other. And if there is contact tracing that is, or someone tests positive, then you know exactly who they were working with. So that's been done in all the areas, in the hangars, in the airport, and including for the crew. So if you're flying a 787, captain, first officer, and the cabin crew are clustered together as much as possible. So that clustering ensures that these people do take care of each other. If someone develops a symptom, they report it. We have a hotline number that you do report. So our staff, part of the software that has been talked about is awareness. Before each flight, a team of medical staff briefs the crew about what to do if they encounter someone who has the symptoms of COVID. In addition to that, for protection of our crew, so the service removal for the shorter flights is actually for protection not only of the passengers but also of the crew, to limit the interaction within the aircraft. Now, they are dressed like medical doctors. So our cleaners and our cabin crew are dressed like medical doctors. They wear gloves, surgical gowns, masks, and hairnets, and sometimes booties. And our staff at the offices, we have a policy whereby if there's more than 8 people in a meeting, the meeting is online. So that way we limit the number of people sitting together, and that is also to ensure that we break the chain of spread of COVID. Just but a few.
Thank you. I think it's interesting. We are only 4 here.
I'm actually
when you
surprised.
Say we are more than a certain number, we go online.
Yes.
I was just checking that we shouldn't be online.
Yes.
Yeah.
Good. Colonel, you know, one of the things that happens, particularly with the operators, a majority of the operators in the country, you have the airlines like Kenya Airways, but you have a majority of charters who do a lot of charter work, and a good number of them also do medical evacuations. I don't know, how prepared are they in terms of responding to carrying or transporting people who are sick and suspected to be COVID positive in terms of the charter and the medical evacuation flights?
Yeah, thank you, Lawrence. I think that's a very important question. But first of all, I'll say that most of the air passengers are actually flown on scheduled flights.
Yes.
The charter flights only come in at a lower level because really they are aircraft that are smaller and are actually hired by most probably families. The same family, just like you drive your car with your family to wherever you are going, you are actually taking a small aircraft as a family. The only difference from the family is that the crew is not a member of your family. And the arrangements that are there in the charter flights is that they will be in the passenger seats. Yes. And they have no contacts, physical contacts with the pilots and the crew.
Yes.
Or let's say the cockpit itself.
Yeah.
So we are very safe. But what we are doing, where you are actually allowed in your house with your family to stay without physical masks, in the aircraft, even if you're coming with your only 2, 3, 4 children and your 2, 3 wives, if you have those, they must have the masks.
Face masks, yes.
And they must be sanitized, and they must, look at all these other temperatures must be taken, and so we are very safe even as charter. Coming to medical situations where their passengers are sick, like we said initially, is that the air industry is very, very high regulated. It's not everybody, it's not every aircraft that can go and pick a sick passenger.
Yes.
There is a classification of those kind of aircraft that are called Medivac, licensed aircraft. And those aircraft are like, for instance, maybe I can mention like Amref is one of those that is licensed to do Medivac, and also Phoenix Aviation. Yes. So when there is a passenger that is sick, maybe in the Masai Mara or somewhere else, or even out of the country, because we actually bring a lot of sick persons from outside within the region to Kenya, Those are special flights that are actually done by authorized aircraft operators that are MEDVAC backed. So we are quite safe, and like I said before, the passengers are safer in the aircraft than in other modes of transport.
That's very important to note, because so that the passengers also have the confidence that it's not an aircraft you're going to board today for your holiday that carried a sick person yesterday.
Yeah.
So there are specific aircraft that are meant for medical evacuation, just like we have the ambulances, and specific organizations with the capacity to handle that kind of work. As we come towards the end of these, gentlemen, the Civil Aviation Authority has, as the regulator, done a number of things to be able to allow for the resumption and restart of air passenger operations. In your own views, do you think that the Civil Aviation Authority has done sufficiently enough to support this? And what could be done to better improve facilitation on your side to be able to effectively continue with the recovery of the industry? I'd like to start closer to me with Simon.
Well, I think, my colleagues have mentioned how, aviation has been, is largely well regulated. I think more for us as an airport operator, it's about what we have done. I would like to say that the Civil Aviation Authority, in my role and those of my seniors, we have actually collaborated already in setting up the protocols for the resumption of civil aviation. And I think that in itself was a good, firm step forward. So I think, we're making the right moves. But maybe I could talk very quickly, not to take away from your point, talk very quickly about what we have done as an airport operator to support the industry. And I think that's quite important for the other members of the industry who are not present. So the Airport Authority, in my opinion, and of course I'd say supported by some facts, is the fact that we have actually waived parking charges for operators that were affected by the cessation of movement during the COVID pandemic. So, and I think some of my colleagues here could bear me witness. We have absolutely enjoyed waiver of parking charges. Now, talking about the business community is quite important in that we've also reviewed our rents with an idea to amortize them over the duration of time. That also will mean that they will pay a rate for the months that they will operate. Yes, very, very important, amortized over a year. Yeah, there are further measures that I think the Airport Authority has also taken significant strides on, relating to a review of concessions as well, and how we share revenues, which I think have been quite favorable for those who were not operating, and will give them financial relief as they resume their operations. More can be done, and I leave that to the board and senior members at KAA to actually discuss and figure out a way to move forward. So I think in a way, you and I are both in KC and KAA, a relatively privileged position in that we can say we've done something, yes, as opposed to having something offered to us. So we've started the process.
Very good.
Thank you, Lawrence.
Colonel, what?
Yeah, thank you, Lawrence. I don't think I'll be as soft as
Simon.
My colleague Simon, Peter Simon.
Okay, here comes.
But I will say, from the point of view of representing the air operators, that yes, something has been done, but much, much more can be done. Okay. But let me start by the positive side by saying that the collaborative decision-making process that is a principle of ICAO has actually been very well conducted by KCAA, in that they actually made sure that everybody, from that is affected by the aviation industry, all enabled. The aviation industry is really an enabler of many economic activities, were involved in crafting the protocols, and we participated from date one as the Kenya Association of Air Operators representing our members to the last bit when they were actually, the protocols were approved. And that is fantastic. That is great. However, the aviation industry, as you know, is a capital heavy and very dependent on very huge amounts of money. Equipment is very, very expensive. operating costs are very, very expensive. And so that makes it very difficult for it to take off when the numbers of passengers, like we talked about, are still low. Because you see, these aircraft are still being maintained at very extremely high costs. So there is, and this is where I'm talking about the negative bit about it, there is much more need to look at how we can make sure that we maintain an economically viable aviation industry, which is a role for KCAA.
Yes.
And what we need to do here is just talk about, how can it be done, because it really will look at how you minimize costs, so that you can put as much of the cost towards making sure that the aircrafts are safe as they are required. So we look forward to seeing that things like the regulatory charges that you charge today are either waived or reduced. There are issues like the landing and parking fees that we have been told about 1 year, only 3 months is what we were given. We hope we will get much more, and we are going to appeal about that.
Yes, yes.
Because you see, like Kenya Airways pointed out, they are doing very few frequencies at the moment. And so are all the other very many air operators, and there are very many out there. As you know, we are the largest aviation industry within the region and beyond, only second to South Africa in Africa. So we are huge, and that doesn't seem to be realized. So KCAA has done its bit of sustaining the economic activity in the country. But how will you support it so that it continues? It's making sure that those areas that we have just talked about, the regulatory charges, the navigation charges, and all the others that the KCAA normally does, are dropped. Also, the availabilities of inspectors on the spot immediately. But I'm sure we'll be talking about collaboration. We don't want to talk too much about that. Yeah, but we are working quite closely together. The other one that, given this opportunity, is that the government needs to come in. Yes. And give an economic stimulus package, like they have given some of our colleagues. Yet those industries are not as badly hit as the aviation industry. We would like to see a fair share of the stimulus fund dedicated to the aviation industry. It's a very delicate industry, yet it's a very important enabler of the national economic activities.
Yes. Thank you very much. What Colonel Waithaka has spoken goes to the core of the mandate of KO. And we hear you, and I think that is one of the reasons why we're having these conversations, so that we can be able to pick out what we can do to better improve the issues. Captain.
Super. Now, let's start by what is aviation and what is an aircraft and an airport. To break it down to simple terms. An aircraft that takes off from New York to JKIA has just created a highway within 12 hours into an airport. And the airport is a roundabout that generally the passengers get out and they get into another highway and they get into another aircraft and go from Nairobi to Mombasa or Nairobi to Mwanza or Kitale or Wilson Airport to wherever they are going. So the aviation industry is an enabler to an economy. And that is something that has been quite difficult to get the Kenyan public, first of all, to get behind the aviation industry and understand that it is 5% of the GDP. We support the team that is sitting here and the people behind them. Between KAA and KAO and KKQ, we support 400,000 jobs that are not directly linked to aviation.
Yes.
Service industry. Hotels have shut down because we're not bringing the passengers in. The little mama mboga, by the way, who sells their wares from their farm, some of their food goes into the catering in the aircraft, all goes to London. So the aviation industry is an enabler to the economy. Now, to something you talked about, which is facilitation. There's an annex in ICAO which is facilitation, which I'd never read.
Annex 9.
Annex 9.
Yeah.
I'd never read it because things used to happen well. And facilitation, you know, when you get used to going home and your meal is there, you don't realize that this annex actually exists. And now I had to read it. KCAA, or the CAA, has done a good job in terms of facilitating during the COVID environment. And I'll just point out but a few. I'll start with in April, we put out a request for transportation of cargo in the passenger cabin,
Yes.
which is Regulation 189. And we put in the proper documentation and we were granted approval to carry cargo in the passenger cabin. That is part of facilitation. That has been what has helped generate revenue for both us as an airline, generate revenue for the CAA in navigation charges, and generate for KAA in terms of landing charges. So that has helped in terms of facilitation for everyone. And you might not see it directly, but it's benefiting you in the pocket, including the oil marketers. Second one was the circulars, AICs that were rolled out from AIC. I think I remember from 15 to 18, but I know there are others.
It was from 13.
From 13.
Yes.
But for me, I remember 15 because that's the one that actually felt like it was facilitation.
Where the leaf started.
Where we started getting leeway to be able to get some dispensations, and that's what we remember. To the security one, which I believe is AIC 17.
Yes, 17.
So for that, I think we say that CA has done a good job, and also KAA. So I'll talk about some of the things they're doing. They're repairing the tarmac within the airport in this time, which is part of collaboration decision making. So that's welcome from both the CA and from KA.
Thank you very much. It is important that we get a feedback, and we also appreciate in terms of what we should be able to do to support each other. The contribution by Colonel Waithaka regarding some sort of stimulus is very, very much welcome. And I think with the right presentation to the decision makers, we should be able to come up with some kind of a decision that should be able to support the industry. We all agree the aviation industry is a key player as an enabler of the economy. And in fact, in some countries, they've leveraged on aviation to really do much, much more than 5% of the GDP. So as we come to the end, I'll just give you a minute or two. You are seasoned aviators. You've been in this system for a while. We've discussed what is happening amid COVID-19. And just your parting shot regarding the way operations are right now and what they were before COVID-19. Captain.
When I took up the job, I never thought I'd signed up to deal with a pandemic. And I never thought I'd signed up to look at parked aircrafts. That was not part of the job description. My job description is operations. So in April was a depressing month for myself because aircrafts were parked. Slowly, we started seeing cargo aircrafts, and then we went into coming up with protocols that enabled the restart of passenger operation, and then now into international operation. As an airline, we want to advise our passengers and our staff members that we will maintain a high level of safety, high level of security, high level of hygiene, so that we can mitigate against the spread of COVID and ensure that our staff and our passengers remain healthy and are able to help us recover the industry to what it was before and even better. Aviation always recovers. There's been shocks like this in the past, but always recovers and does better.
Colonel.
Yeah, thank you, Lawrence. I think, first of all, I thank you for inviting us to come and exchange these ideas. And also perhaps to finish by saying that the COVID-19 happening is a crisis, not only here, but worldwide. And out of just to echo my colleague's words, in crisis, you also get opportunities because it opens doors for you to think wider. And the fact that we seem to have already, I'm not saying that it is done, but already found out ways and means of fighting the pandemic, I think we have learned quite a bit and improved our services even more. And that is the trend in the aviation industry. It always gets a kick up, a jump up when there are situations that are challenging. So one of those is like this, and it also helps us to all come together. Like we said that the association has got a majority of the licensed people, and I'm sure now, because of this crisis, we will have to see other air operators that are not members of the association joining us. And remember that, and CAA is aware that we operate all our members are supposed to operate within the very strict code of ethics that the association has. And that has helped us even make sure that the standards that have been set by the protocols are even enhanced, that they are actually operating above that. So I would just request through this opportunity that let the air passengers come back. They have confidence that they will be very, very safe and secure, not only for the reasoning of the COVID-19, but any other safety measures and security, aviation security requirements. Thank you, Lawrence. Very, very good.
Thank you, Colonel. Simon.
Thank you, Lawrence, and also the rest of the panelists. I think we've had a really robust conversation here today, and again, can't say thank you enough for hosting us, such an esteemed group of people. Thank you. So my experience in the aviation industry is fairly limited, and I'll just share a little bit about what I see inside facing out and then being inside and seeing around the room. My mind goes back to 9/11. 9/11 happened. The aviation industry took a real beating real quick, changed its way very fast, moving very quickly to Ebola. Things changed again. All of a sudden it was temperature screening. And I think before Ebola there was SARS and MERS-CoV and all that. And now we are in COVID-19. Now, COVID-19 has ushered the world into what is being called a new normal. I repeat myself, the era of biosecurity, or epidemiological security, if you want to call it appropriately. What I see is a story of hope. I also see a story of consistent change. And in as much as it's a heavily regulated industry, I'm expecting that we'll come out of it a lot stronger. So yes, a dark cloud has got a lot of silver lining right now. I think that our message to the public should really be that, one, all the mitigation measures that are existing are for the benefit of the passenger, the service provider, and those they will find in other countries. So the reality is the world is moving very closely to a more coherent approach towards dealing with the COVID pandemic. And aviation, much as it is a cog in the economic wheel of many countries in the world in general, continues to be a key player. And we at the Airport Authority, together with yourselves and the operators, are doing everything we can in a collaborative frame that will allow us to make the world a better and safer place. My parting shot to the traveling public is welcome to a new world of more orderly travel. Welcome to a new world of a much safer way of travel. And welcome to a new world of, I would say, a much better travel experience. Because you're safe and the person you're going to meet on the other side is safe. And with that, we are keeping the entire ecosystem that relies on us, the tourism. What else? The food and beverage. What else? The mama mboga, shopping centers. We're keeping all these places open because aviation is continuing to grow. So in my opinion, a great deal of hope, a great deal of green shoots, and I look forward to coming back, hopefully here with the same group of people at some point in the future where maybe we can actually start talking about how things have become better. Because today we are in what is called the inter-COVID period, the period of restart. And where I sit, it's not going to last forever. We will come back, and it's going to be a much better and safer world where people can connect with families, friends, and actually do business with aviation. So thank you very much once again.
Thank you very much. That brings us to the end of our discussion today. And as you can see, the aviation industry, represented here by very able gentlemen, are speaking the same voice, that aviation is resilient, aviation is ready, and aviation is safe. You are welcome to continue traveling, continue having the air travel experience in a much safer, a much more secure environment, even as we recover. And the aviation industry, of course, expects with your continued travel, with your return to the air, we will be able to recover much faster and do our role in building the economy. We would like to encourage you to continue engaging with us on our social handle, on our social media platforms, Facebook, Twitter, Instagram, in the handles in the description box below. Thank you very much.